Ospedale Bambino Gesù in Roma.
Allora, scusate, ma Cecchetti è occupato nella città. Cecchetti
non viene.
Is in Santa Marta, but we have her presentation with the voice I show. Va bene, la mostro io un
so
attimo.
we just have his voice.
Vediamo se funziona, Benissimo.
Good morning from Rome. I'm Corrado Cecchetti, head of Pediatric Intensive Care Unit in the Emergency Department of the Bambino Gesù Hospital. So I'm afraid because I'm working in a place in which I have any possibility to make it. So I show you my slide with a question for see with you the difference on if there is some different aspect in other emergency department. Really, the impact of COVID on the pediatric emergency is apparently limited. However, it was necessary to evaluate the pathway of the emergency department, using also the tools of a continuous training that integrates simulation training to guarantee safety on the roads. It's important not only to evaluate the simulation program on the scale, but really to evaluate the part of the patient since the take of care in the hospital at the end of the evaluation. Really, we reevaluated the concept of triage, guaranteeing in our hospital a pre-triage form. Pre-triage paths aimed at the earlier identification of the patient with a greater risk. Furthermore, the Bambino Gesù Hospital was divided into big areas, Rome that we can define COVID-free, and Paridoro instead COVID center, with transportation directly of the emergency system in direct form. I thought it also became necessary to define Rome's safe route for COVID children arrive from home. So it's important to maintain this hospital in Rome free from COVID patient for maintaining usually and ordinary activity for the emergency, for the transplantation, or all activity for the Rome and for the Italy in this case. Really, about the definition of a suspect case of coronavirus infection, there is any or new. Really, we use the same criteria of WHO. So, are the usual criteria of suspect case of coronavirus. So, there aren't difference in this sense. Also, for the definition of case confirmed, are all cases with laboratory confirmation for SARS-CoV-2 infection, so are the same. We are different. We are in different situation. The diagnostic confirmation occurs through laboratory tests to identify the virus. So it's very important that from this moment, the level of safety for patient, for the pet in the hospital is full. It's a most important level of safety for this kind of patient or for this situation. But really, we thought that every suspect patient, until the diagnostic confirmation through laboratory tests, is really, we treat the patient in the same way. So I think that it's important not only the organization, the organizative aspect of the part, but also being able to guarantee the patient the most appropriate and early treatment. Sometimes, especially in the most critical phases, patients really stay in the emergency department for longer than usual. It is essential to support this patient with the optimal respiratory therapy and the hemodynamic support. In this two slides, I present the two models adopted in the center of Rome and Paridoro. Paridoro is a COVID hospital, but Rome and Paridoro respond to the same logic as a pre-triage near the emergency department, so as to be able to start the patient in a safe and differentiated bed from the hospital. The clinical aspects of the pediatric patient at the moment are not being characterized by a particular critical picture. However, it's very important, it's essential that the organizative aspect and safety don't delay the early start of respiratory and hemodynamic support therapy. For example, in children with COVID infection and hypoxemia, begin supplemental oxygen therapy by nasal cannula, or when the oxygen saturation are lower than 90%. If patient continues with hypoxemia, oxygen delivery by face masks with reservoir can be considered. So there is a strong recommendation to begin other non-invasive ventilation technique. So it's very important, also like strong recommendation. Thank you.
Okay, so it's a pity that we don't have Dr. Cecchetti here with us, because at this point we cannot ask any question, and